Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of internal medicine is sexual dysfunction. We will cover our topic of sexual dysfunction in 5 sections. In the first section, we will talk about male sexual dysfunction. And when we will talk about this topic, we will discuss mainly the physiology of male sexual response, neural control, penile smooth muscle relaxation and erection. And then we will talk about the biochemical pathways modified by PDE5. Then in the second section, we will talk about erectile dysfunction, what's the epidemiology and pathophysiology of erectile dysfunction, what's the different medications that can lead to erectile dysfunction, and how we can approach to the patient with erectile dysfunction. Then in the third section, we will talk about the treatment of erectile dysfunction, patient education, what are some oral agents that are used for this dysfunction, androgen therapy, vacuum constriction devices, and also we will talk about surgery, sex therapy, and some other methods of treatment. Then after this, we will talk about female sexual dysfunctions. What's the epidemiology, physiology of female sexual dysfunction? What are some risk factors that can lead to this dysfunction? How we can treat? What's the approach to the patient with the sexual dysfunction? And in the fifth section, finally, we will talk about hirsutism. What's the clinical assessment of hirsutism? How we can evaluate different hormones involved with the hirsutism, and the treatment and approach to the patient. So all these 5 sections will cover our today's topic of sexual dysfunction both in male and female. So keep watching sqadia.com to learn about this topic.